Kristin Pelletier, founder of KP Consulting, where we help dentists reduce stress, increase profitability, and create a practice they love. Today I want to ask you, how do you know if you're allowing adequate time in your hygiene appointments? I want to give you 3 things that you can look at that will help you determine if you need to add more time. I've seen both ends of the spectrum. Some practices that have too much time on the schedule where it really makes it hard to be profitable when you're spending too much time in the appointment. And I've also seen the other end of the spectrum where the hygienist is not given enough time to do all of the things that create more opportunities for the practice in that appointment. So 3 indicators that you need to add more time to your hygiene visit. Number 1 is, are you rushing the important diagnostic and information gathering portion of the beginning of the appointment? For example, maybe you have time to get your bite wings taken, but we really don't have time for the intraoral camera. Or maybe we have time to perio chart, but we don't have time to use some of the visual aids, maybe a hand mirror or the intraoral camera, to allow the patient to be a part of that process. So that's number 1. Number 2 is, if you don't have enough time to create or speak to the value of what you're doing. For example, I know lots of offices that routinely at every hygiene visit do an oral cancer screening, as we should be in the dental profession, but some of the practices that I've observed, their patients aren't even aware that this valuable service is happening. So think about your tone and your pace during your appointment, and are you skipping those important verbal skills and that dialogue with the patient to really create that value? The third indicator that you need to add time to your hygiene visit is if you feel rushed when you're talking about the treatment. Just because you have enough time to speak to the treatment and to tell the patient what they need doesn't mean that they've had enough time to actually get it or understand all of the things that they need to feel comfortable with before making a decision about treatment. So if you cut corners on the beginning of the appointment and on the end of the appointment, that's where you're really missing big opportunities to increase case acceptance and to create value about your practice and all of the things that you're providing to your patients. So your homework assignment today is to meet with your hygiene team and write down all of the things that you would like to have in that hygiene appointment to make it ideal. So if you had all the time in the world, what would you include in that appointment? The next step is just put a time next to each one of those things on the list and see where you end up. This will be a good indicator on where you may need to make some adjustments. I hope this tip was helpful. For more practice management tips, visit my website, KristinPelletier.com.